Ms. Van Duyne is recognized.
Thank you very much, Mr. Chairman, and thank you to our witnesses. I know it's been a long day. Today's hearing is about access to quality care for all Americans and affordable options for getting that care. 2 weeks ago, I hosted a healthcare roundtable in my district, and I heard firsthand from our current healthcare model that our current healthcare model lacks transparency and has caused people to second guess not only their health care, but how much they're paying for it. And let's be honest, I mean, the fact that patients have absolutely no idea how much they're going to pay for a bill or how much when they start getting the bills, they're going to end up paying for it is causing that frustration. And the cost of health care is skyrocketed, and I'm glad that you're experiencing some relief of that, but it's definitely not universal. We need to work on how our market and how it is structured. I mean, I appreciate what Congressman Moore was saying, that healthcare costs are ridiculous. Here's what I've found. The more federal dollars that we put into healthcare, the more costly it is, the less access people have to it, and quality is suffering as a result. So it can't just be putting more federal dollars in, because every single time you get more federal dollars in, you've got more reports you have to fill out, more red tape you have to go through, and less time you're actually spending with your patients. So I mean, I look at the costs continuing to rise. I'm like, what can we do to actually help our patients? What can we do to help our constituents? Understanding, and this is a big one that people tend to forget, having health insurance is not the same thing as having health care. Our focus has to be on the care and not just providing insurance companies with more money. So, our country desperately needs pragmatic legislation to reduce these costs and to facilitate long-term savings and revamp our broken healthcare system. So I'm actually proud to introduce innovative, imprudent bills with a hope that my colleagues can see across party lines to adequately address the failures within today's healthcare system. I've introduced a number of bills which would expand HSAs for children, that would add flexibility and would build on the success of HSAs. I know Congressman LaHood had asked you a couple of questions about HSAs, but I want to get more specific if we could. And Mr. Short, do you believe that HSA contribution limits should be updated to help families better afford health care services?
Absolutely. I mean, the rising cost of care is outpaced inflation, so we need to keep up with the contributions to keep up with it to allow families to be able to pay for health care.
When was the last time that they were updated, and do you think that the updates that they have had on an annual basis have been enough to keep up with inflation and actually costs that they're paying out of pocket?
I believe they were recently updated recently by a few $100s, but It's not keeping up with the rising medical inflation we're experiencing.
Do you think that they should be they should be expanded to include like a children's HSA or an ability to be able to pay for adult parents, perhaps?
Oh, absolutely. Again, any way we can allow for individuals to save and plan and use funds on a tax basis for medical care, maybe for dependents, maybe for elderly parents, is absolutely important and critical and a great step forward.
What do you think are some of the barriers right now that exist that would make them less effective than they could be?
Oh, I think by allowing HSAs for all. Let's get rid of these different insurance mandates. You have a certain type of insurance to be able to have HSAs. Let's have HSA be available for all Americans, regardless to what type of plan they have.
Okay, so what you're suggesting is right now they've got the high deductible health plan. Can you talk a little bit about what that is?
Absolutely. So today you have to have a qualified health plan to be able to contribute to an HSA program. And that just seems counterintuitive that if we allow people to choose the type of plan that works for them and their families, that we can then allow for them to also contribute to the HSA, allowing anybody and everybody that has a plan or any plan or no plan to be able to contribute would be a powerful force into bending the cost curve in the United States.
Do you have an idea of what you think that the HSA limit should be?
I don't, but healthcare is expensive, so the more that we can allow people to save, to be able to plan and pay for healthcare would be critical and important to help out everybody.
I appreciate that, and I yield back. Thank you.
Ms.